It's time for the Kim Hammer Show, where you'll learn how your state government affects you, your family, and community. Here's Kim Hammer.
Good afternoon. Welcome to the Kim Hammer Show. Glad to have you joining us on another beautiful Saturday afternoon. Hope you're getting all your Christmas shopping done. And if you are driving around out there, please be careful. I did notice that some of the malls are filling up and a lot of activity going on. Do want you to be careful, though. Wear your mask, keep your distance, and practice good safety. And we want you to enjoy Christmas holiday, but we want you to enjoy it in a safe manner. With regards to the to the sponsors of the show, I want to give thanks to Everett GMC Buick down in Saline County at I-30 there on Alcoa Road, Baxley, Penfield, Mountie Real Estate, serving all your needs here in Central Arkansas, and also Edwards Food Store and Edwards Cash Savers here in Central Arkansas and over in East Arkansas. A great food store chain that always has everything you need at affordable prices in a clean environment with friendly staff to greet you and to help you even if you order your food online and have it ready to go. They'll be glad to get your groceries to you. So I encourage you just to give Edwards Food Store and Edwards Cash Savers a look. They have a great meat market, great produce, excellent hot food bar in the morning for breakfast, and they can take care of all your needs. We're glad to have on the Kim Hammer Show today Dr. Dillaha from the Arkansas Department of Health. And perfect timing, Dr. Dillaha, because I'm looking at the news report, and FDA authorizes the Pfizer vaccine, and heard that they're going to be shipping that out first thing in the morning. And so thank you for taking time out of your busy schedule to be on the Kim Hammer Show today.
Well, thank you for having me. I'm really glad to be here.
Good deal. Say, can you, the focus is going to be on the vaccine. Had some meetings this past week. I know you all have been knee deep in it. In fact, actually had Randy and Donna Wright were on a few weeks ago because they are actually conducting one of the vaccine trials for one of the pharmaceutical companies here in Little Rock. And so vaccines are on everybody's mind. Can you just tell us what it means to Arkansans that the FDA has authorized Pfizer vaccine to be released and how that's going to translate down into the world of Arkansans?
Well, sure. You know, we're so happy to have a vaccine that has proven to be safe and effective that we can use in Arkansas. This offers us a lot of hope about getting beyond this pandemic and getting back to our usual lives. I think this is going to be really helpful to us. Of course, when we get vaccine, we will have few doses, not enough for everyone. And so we have decided to focus the initial doses on vaccinating healthcare workers. And there's not enough for all healthcare workers, so we're really focusing on hospital workers, and those are at highest risk because they take care of COVID patients.
And with regards to the amount of the vaccines that are coming in the state, and you correct me if I'm wrong, but we've both been in several meetings this week, but I think the initial dose is 25,000 that is actually going to get into the state. Is that correct?
That's right. It's a little bit more than 25,000, and so it's going to be shipped directly to the larger hospitals, and then the smaller hospitals will have allocations made and delivered to them through 5 different pharmacies that have mobile vans.
Okay. And we'll kind of slow it down a little bit and just talk about how it spreads out through the state. But the 25,000 vaccines, talk about the vaccine itself and what people should expect whenever it gets to where they can get a vaccine. Is it a shot that you get initially on the front end and then 3 weeks later you get the second half of it, or does that depend on the the vaccine and which company's putting it out, how it's going to be applied?
Yes. So this particular vaccine is made by Pfizer, and it is a shot. It's called an intramuscular shot. It's just like getting a flu shot in the shoulder and the deltoid muscle. And then a second dose will be needed 21 days apart to provide full immunity that the vaccine can give. So it's going to be important for people to keep track of the timing and not get it any sooner than 21 days. And also, there may be other vaccines that become available, so people should know that they need to get the second shot with the same vaccine type that they got the first shot with. You can't mix them. They don't work that way.
So if a person doesn't get the second portion of it, the second shot 21 days later, then they're actually not going to be covered from the vaccine because they only got partial dose. I mean, it's not something you can
Right.
just opt not to do and expect it to work.
Well, it may offer partial protection, but that's not optimal. We want everyone to be as protected as possible.
Okay. And the other vaccines that are coming down now, the Pfizer vaccine, is that the one that's got to be stored at like 75 degrees below zero?
Yeah. So minus 70 degrees centigrade, which is, I think, minus 94 Fahrenheit. So it requires special handling, and you can't move it around very easily. In addition, it comes in trays of 975 doses. So the places it can go to have to be places that can handle the minus 70 degree storage. Plus, they have a large number of people that could use the vaccine because you just can't move it around very easily.
So how will it transport once they send it out in the morning? Just kind of walk it through from the time it'll leave Pfizer, if you know, from the time it'll leave Pfizer till the time it actually gets to the pharmacy that's going to be distributing it. How does it get its way into the state? And then once it gets into the state, how does it get pushed out to the various pharmacies or outlets?
Well, Pfizer is shipping it through, I believe, UPS. It could be FedEx. It may be both, depending on the situation. But there are special shipping containers that contain dry ice. So the dry ice is packed on the bottom and the sides and the top with the vaccine in a small box, in a tray in that box. And the dry ice can maintain the minus 70 degrees needed. And then it will be transported. It's got a monitoring device that monitors the temperature of the vaccine and sends it signal back to Pfizer so they can track where the box is and what the temperature is. And then it will be delivered to the sites. We've given the Operation Warp Speed and the CDC all of the information about where to ship it. And it will be received at those sites by a designated person, and they'll acknowledge the receipt of the vaccine and store it properly. It can be stored in the shipping container, but you have to replenish the dry ice as it sublimates. And so there will be a box of dry ice that will accompany the shipping box with the vaccine in it so that the recipients of the vaccine can use that to top off the dry ice as it the amount lessens due to time and the way that dry ice sublimates.
Okay. Now, it gets into Arkansas, and then it's going to go out to the pharmacies. Do you remember? I know one pharmacy because it's in my district, but the pharmacies that it's going to go out to, are you at liberty to share which ones those are, or how is that network going to expand? These pharmacies have bought the equipment to keep it at the temperature required, but what can you tell us about the distribution from the time you receive it to the time it goes out to the pharmacies?
Okay. So it will go directly to the 5 pharmacies that are receiving the initial shipment, just like it's going directly to some of the hospitals. Other pharmacies have enrolled in the vaccination program, but they won't be receiving vaccine with this initial allocation. It's just these 5 designated pharmacies that have agreed to participate with us in making the vaccine available to these smaller hospitals in the state that cannot use the 975 doses that come in a tray. So, and they have mobile capacity. They will be taking the vaccine to each of their assigned hospitals. Those hospitals are collaborating with their assigned pharmacy about when they want to receive it and how many doses they will need to vaccinate their high-risk employees.
Okay. The vaccine that is coming out is the one that's requiring the excessive refrigeration. Do you know the ones that are coming behind it? Are they going to require the same treatment, or will they be different? Or A, are you at liberty to say, and B, do you know?
Yes. So the one that is most likely to come next is the Moderna vaccine. It is also a frozen vaccine. It requires freezing temperatures at minus 20 degrees centigrade, but this temperature is well within the range of the freezers that we currently use to store frozen vaccines. Not all vaccines are stored frozen, but some of them are, and people may be familiar with the MMR vaccine that protects against measles, mumps, and rubella, or the varicella vaccine that protects against chickenpox. These are frozen vaccines, and so a lot of places have the proper freezers for storing them, and this will be the same type of freezer that the Moderna vaccine will need to be stored in. There are other vaccines coming, and I'm not as familiar with their storage requirements. I know at least one of them is refrigerated, and that will make a difference in terms of storage. The other thing that's important to know is that the Pfizer vaccine, when it's thawed, it can be kept in the refrigerator for 5 days. And the Moderna vaccine, if the FDA approves it this way, will be able to be kept in the refrigerator for 30 days. So that makes it a little bit more flexible for distributing, because you can keep it in a cooler that's not frozen in order to transport it places to give the vaccine.
Okay. Let me just take a quick second to acknowledge the sponsors: Everett GMC Buick in Saline County there on I-30 at Alcoa Road, Baxley, Penfield, Mouty, Central Arkansas. Take care of all your real estate needs, whether it's residential or commercial, buying, selling, renting. You have property you want to rent, you're looking for property to rent. They can take care of you. And then Edwards Food Store and Edwards Cash Savers here in Central Arkansas and also over in East Arkansas. I'll go ahead and tell you now that I've got confirmation Senator Jason Rapert will be filling in for me next Saturday. I've got to be off to do a funeral for a church member that passed away, and so Senator Rapert has graciously consented to fill in for me next Saturday. So I think he'll have an exciting lineup. He's working on developing that, and we will be glad to promote that throughout the week, so you'll know the topic for next Saturday's Kim Hammer Show. We have Dr. Dillaha from the Department of Health on. We're talking about vaccines. So, Dr. Dillaha, when the vaccines come in, the initial dose is only going to be 25,000, and you mentioned those are all going to go to healthcare workers. Will that be strictly for healthcare workers in the hospital? And I know 25,000 is a small drop in the bucket against the 3 million plus people we have in Arkansas, but I also know you got to, the federal government has to look at the big picture and realize you got to do as much as you can to get it out as quick as you can, but you got to start somewhere. So will that 25,000 just be going to healthcare workers in the hospital, or will it be to healthcare workers in other settings as well?
So almost all of it will be for healthcare workers in the hospital. It's important that we protect those workers because, as you know, our hospital is under a great deal of stress with the high patient load that we have right now. And whatever we can do to decrease absenteeism of workers is going to be very important in order to maintain our bed capacity. It's not so much the number of beds, it's the personnel we need to take care of the patients in the beds that we're struggling with in Arkansas. There will be some that will be going to the Arkansas Department of Health to vaccinate our workers who are doing testing and will also be vaccinating other people. And we are still working on plans, but the hope is that we can extend some of that to some of our first responders, especially those that do patient transport.
Okay. And do you know when the next dose will come in after this? Have they given you any expectation, 25,000 now, and you can expect the next dose sometime down the road? Have they given that kind of information out yet to know what the flow is going to be in the state?
Well, we have an idea that the next shipment of Pfizer vaccine will likely be either the week of December 21st or the following week. And we think that the numbers are going to be a little higher than this first allocation of 25,000. I'm not sure how much higher, but we have not received official word, just estimates. And then if the Moderna vaccine is authorized next weekend, then potentially we'll have that vaccine available in Arkansas either the week of the 21st or the 28th of December. And that vaccine is being focused on our long-term care facilities, especially our skilled nursing facilities that house so many vulnerable older adults.
Okay. So if I'm a citizen, and let me back up and take it this way, because I remember seeing a chart. It was like a 3-tiered chart as far as who's in the first wave, who's in the second wave, who's in the third wave. Could you talk through that as far as will it be a case of when the vaccines come in, regardless whether they're from Pfizer or from the other or the third one that's coming down the line, will it be that we'll take care of everybody in category A and then we'll move to category B and then we'll move to category C, regardless of whichever vaccine gets in the state at whatever time it gets in the state? Is that how we're systematically going to move through the population of Arkansas?
Well, in general, that is the case. So phase 1 is when we won't have enough vaccine for everyone, so we're prioritizing certain groups. And phase 1 is divided into 1A, 1B, and 1C. 1A is focused on healthcare workers as well as long-term care residents. 1B is focused on essential workers, and 1C is focused on people who are at increased risk for severe disease if they get COVID-19. So that's older adults or people with chronic conditions, as well as people living in congregate settings. The plans for 1B and 1C are still in draft. We're still working on them, and we're waiting for recommendations from the Advisory Committee on Immunization Practices. 1A, we're starting with hospital workers, but there are a lot of healthcare workers in Arkansas that don't work in hospitals. So as we get more vaccine, we'll be providing allocations to community pharmacies around the state that can partner with clinics and other places to vaccinate their employees. And so it may depend on how we get vaccine and when we move from 1A to 1B. And it may not be totally all 1A and then start 1B. There may be some overlap. It really depends on the vaccines, their characteristics, how easy it is to get them to certain populations, and then what we decide in Arkansas about how we will prioritize groups in 1B and 1C. That's not totally been finalized yet.
Would you anticipate that if you had to kind of throw a guesstimate out there, that by middle of next year, there will have been enough vaccines that will have come into the state that everybody will have been able to get one that wants one? Or what's the forecast or projection as far as when we could say, okay, everybody in Arkansas had one or had the opportunity to have one because we have enough vaccine in the state?
I think that's a reasonable expectation, and I certainly hope by the middle of next year we can get there. I'm going to be working very hard to make that happen, and I know that a number of other people will be as well. So how much vaccine is available depends on how many of the vaccines under development get approved. The Trump administration did a really good job of strategizing about the vaccines. They have funded the development of 6 vaccine candidates, 2 in each of 3 different vaccine categories or different types of vaccines. And so the hope is that at least one of them would be successful in its safety and efficacy studies. And so far, it looks like we're going to actually get 2, and we may get more. So the more vaccines that complete their safety and efficacy studies satisfactorily that can be authorized for use by the FDA, the more quickly we'll be able to get vaccine out to the entire population. And I think that it's hopeful right now. The next two vaccines after the Pfizer and Moderna vaccine, those are looking pretty good. And so we'll have to wait and see, but that it's hopeful. And then there'll be two more coming after those. So time will tell whether we're able to deploy all of those vaccines or some of them, and how many doses they'll be able to make quickly.
Okay. Plug your ears for a minute, Dr. Dillaha, because you're a state employee and you can't respond to what I'm about to say, but plug your ears. And everybody, this is my comment, not hers. This is my show. I'll make this comment. Congratulations to all the idiots that fired President Trump. The man who got it done at warp speed has got the vaccine coming into the state of Arkansas and got it coming into the country and did the great job that he did. And the man may very well be fired unless the grace of God allows us to get it to the Supreme Court and win. So congratulations to all the people that fired the man that just helped stop this dreaded disease that was brought to us. Compliments of China. Good job. Way to go. Put your head in the closet. All right, Dr. Dillaha, back to the vaccine itself, and to answer the question, is the vaccine safe? Are my kids going to turn out green if I take it? Is it going to cause me to have mentally challenged situations? Talk about the quality and about the safety of the vaccine itself so people can make an educated decision on whether they want to get it.
Well, I'll be happy to do that. It's important to know that the vaccine has been developed in record speed, but safety and efficacy have not been shortchanged in the process. Through the funding that was provided to the vaccine developers, they were able to capitalize on studies that were done for prior coronavirus vaccines for related diseases such as SARS, the original SARS, and there's another disease called MERS, which is Middle East Respiratory Syndrome. And so they had it was easy for them to identify a vaccine candidate very quickly, and they could complete the preclinical studies rapidly. And then usually when a vaccine's developed, you go through phase 1, phase 2, and phase 3 trials sequentially. But because of the abundant funding that was made available, they were able to do some of the trials concurrently. Normally, a vaccine developer would never do this because of the financial risk involved. And then on top of that, usually a pharmaceutical company would not start ramping up their production and making millions of doses of vaccines until it had been approved by the FDA. But in the cases of these vaccines, the Trump administration made funding available to the pharmaceutical companies to scale up their production and make millions of doses even before the vaccine was approved. And that's, of course, a very big financial risk, because if the vaccine is not approved, then all of those doses have to be discarded. So that's why within, a day or two of the emergency use authorization by the FDA, they're able to start shipping vaccine. And it's because of the risk and the funding that had been provided to do it, make those doses beforehand. So that's why we're able to have vaccine more quickly. The safety and efficacy studies have been fully completed in the right way to meet the scientific requirements to verify that they are safe and effective. The FDA has authorized the use of the Pfizer vaccine. They may authorize the use of the Moderna vaccine. And I think any vaccine that makes it through this full process will be safe and effective. Since I've been the medical director for immunizations, I think 7 years now, I've learned enough about the process that I have confidence in it. And if something is authorized as being safe and effective, it will truly be safe and effective.
Very good. So let me ask you, is this going to be something that people will have to get every year, just like the flu shot?
I do not think that will be the case. We don't know yet what the duration of protection for the current vaccines will be. It will be monitored over time. And it is possible that people would need a booster dose in the future. But one reason we need a flu shot every year is that the flu viruses mutate so rapidly, and the flu that was circulating last year might be different than the one that is circulating this year. So you need a new vaccine that matches the current flu virus. The coronavirus does mutate, but not that rapidly. So it's very possible that the vaccines that are developed now will really provide immunity that will last over a period of time. And if we need a booster dose, then that can be determined with the ongoing studies that are being conducted.
All right. Anything else about the vaccine you'd like the general public to know, Dr. Dillaha?
Yes, I do want people to know that the current vaccines, when you get a shot, is known to have what we have reactogenicity, which means when people get the shot, they're going to have a sore arm. They may feel ill for a day or two. They may have fever. And that is to be expected. So people should go into getting their shot knowing that. It shouldn't surprise them. It's more likely to happen with the second dose. And the older you are, the less likely it is to happen. But people should be aware so they can make an informed decision and not be surprised. They should be prepared that this shot may make them sore and it may make them feel ill for a short period of time.
One question: when they get the vaccine, they don't have to quarantine or anything like that. They can get the shot, and just go on about life as normal, unless if they're running fever as a result of getting the shot, are they going to have to quarantine, or can they just push through, or what's the protocol?
So the vaccine doesn't have a live virus in it. So even if you get sick, you can't transmit anything. It's just your body reacting to the vaccine. The hard part is going to be able to tell, is this the vaccine or have you actually been infected with COVID-19 and it's a coincidence? So people will have to sort that out. And it may be that if they're running fever and feeling ill, they may need to stay home for a day or two. So it's a highly variable situation, because not everybody will have that kind of response to the vaccine. But we encourage people, no matter what they think the cause may be, if they have fever and they're feeling ill, to stay home.
Okay. Tell you what, I've got another guest lined up to come on the second half of the hour, but let's maybe touch base in about 3 weeks after Christmas. We'll see if the other vaccine is pushed out by then. We'll know. Now the vaccine's supposed to be in the state the first of next week is what I remember being told. Is that correct?
Yes, that is correct.
Okay. And so we'll have a few weeks under our belt of vaccines in the state. If you're all right with it, after Christmas first year, I'll get you to circle back on the show. We'll talk about the results and how it's going, and we'll be able to see then how many doses we have in the state, how many to expect to come.
All right. That sounds good.
All right. This has been Dr. Dillaha from the Arkansas Department of Health on the Kim Hammer Show. Just want to have you come back here in just a little bit, because we got a conversation that's relevant to a lot of people in the state of Arkansas. I've got Natilie Wooldridge, who's the Arkansas Disability Coalition Family Advocacy Coordinator here for Central Arkansas. Does it ever get under your skin when you pull into the parking lot at the mall or the store and you see somebody get out of their car after they parked in the handicapped parking spot and they don't have the disabled tag on, they don't have the blue tag on? Or does it get under your skin when you see somebody park in the parking spot that gets out and hops and skips into the store and they've got the blue tag on? That's what we're going to talk about when we come back to the Kim Hammer Show after the...
Answer with you anywhere with our free mobile app. 1011FMTheAnswer.com. Your smart speakers, iHeart, or radio.com. Breaking news and stimulating talk. 101.1 FM. The Answer.
Salem Media Group, Little Rock. bringing this holiday message home.
This is Private Handy out of 3rd Infantry Division. I just want to give a shout out to my family and say happy holidays back in Arkansas.
Hey, this is Sergeant Austin Odom with the United States Army Marksmanship Unit. I just wanted to give a quick shout out to all the medical professionals in Benton, Arkansas, my hometown.
Bringing holiday messages home from the troops serving overseas. Salem Media Group wishing you and yours the very merriest of holidays and safe returns.
Here are the facts. Your business needs leads and sales. There are potential customers online right now looking for what you do. Will they find you or your competitor? You need Salem Surround. Having to do your own digital marketing while trying to manage your business, well, there's just not enough time in the day. You need Salem Surround. You're doing all you can to market your business, but are you sure you have the right strategy or seeing a great return on investment? You need Salem Surround. The marketing team here at Salem Surround is ready to help your business now. We'll design a plan that targets potential customers with proven marketing strategies, using everything in our toolkit to work for you. Digital, audio, mobile, even audience-engaging contests and promotions. Contact Salem Surround for a free evaluation of your marketing plan and see how we can help place your advertising message in front of today's consumers. Learn more at surroundlittlerock.com. Surroundlittlerock.com, connecting you with new customers.
American Ground Radio with Louis R. Avalone and Stephen Parr. Listen each Saturday from 5 to 6 p.m. You're just not going to hear this anywhere else.
You know, when the whole Trump family gets together, who do you think is the oldest person in the room besides Donald Trump?
Yeah, I was going to say Donald Trump. He's
besides the President of the United States.
It's Kimberly Guilfoyle.
Kimberly Guilfoyle.
Yeah.
And Donald Trump Jr.'s girlfriend is older than his stepmom.
That's true.
Who is the First Lady of the United States.
That's true. Yeah.
From where I come from, that's just confusing.
Well,
I mean, but you know, some people might say, you know, that's just another example that Donald Trump, he's always winning. I mean, if,
wow, really?
You know, well,
some people might say that?
Some people might say that, not me.
Listen each Saturday from 5 to 6 p.m. on 101.1 FM. The Answer.
Welcome back to the Kim Hammer Show on a beautiful Saturday afternoon. We just had on Dr. Dillaha with the Arkansas Department of Health talking about vaccines. They will be arriving in the state next week. There is a protocol, a tiered system, if you will, as far as who will be receiving the vaccines first. They're going to take care of the frontline health workers in order to make sure that they can stay healthy and allow them to be able to stay on the job because of the critical shortage of nurses, CNAs, and other medical personnel that are treating patients with COVID. And we'll get some information up on the Kim Hammer website over the weekend where you can go and see what that tiered system is, learn a little bit more about it. But we want you just to go up to the KimHammerShow.com, and you'll be able to find that information. Well, as I said, we will get it up over the weekend. For the second half of the show, glad to have coming on to the show Natilie Wooldridge. And as I mentioned a while ago, and she is on the road traveling. I want to say thank you for calling in. Natilie is with the Arkansas Disability Coalition and Family Advocacy Coordinator. So, Natilie, thank you for taking time to call into the Kim Hammer Show this afternoon.
Okay, well, thank you for having me on. I appreciate it.
Very good. You're on the road to Jonesboro, if I remember right. Is that correct?
That is right. I am crossing into the border right now.
All right, very good. Well, thanks for taking time to call. So let me ask you, first of all, what is the Arkansas Disability Coalition Family Advocacy Coordinator? Tell us something about that so people have an understanding of what you do and what the organization you're affiliated with does.
Sure. So the Arkansas Disability Coalition has actually been around for over 40 years. It started off as a circle of parents of children that had special health care needs that saw the need to have a group come together as advocates, as family advocates, to be community advocates, to help watch out for things that were getting overlooked in our special needs families. And so it's grown, and we've done a lot of different types of community programs and outreach over the last 40 years. And in 2009, I believe it is, Arkansas was one of the last states to start a family-to-family health information center. So basically, it's not like a standalone building, but it's a concept of family members who are advocates for other families with special health care needs. And so every state has one, and a good portion of our territories have one as well. That was something through the Bush administration. That was a program that was started, and so there's different funding involved there for that program. Some's national, and some of it we get through a sub-grant through our Title V services. So, we're a nonprofit group, and we try to be there for families as they need, and we try to bridge that gap between professionals that service our families and families who need those professionals.
So in a day-to-day example, you have someone that has a disability. The state offers a lot of services. The federal government offers a lot of services for somebody with disabilities. How do you bridge the gap, as you mentioned a while ago, between the services that are offered and the individual that needs the services? Translate that down to real life example, if you would. And I know you have some personal example yourself. So however it is that you choose to illustrate it, how is it that a person would know exactly how you would bridge the gap?
Sure. So, like in my family personally, I have children that have special health care needs, and I had a daughter that actually passed away last year, but she was medically complex. And so, she needed a lot of health care services, but there were also community resources and a lot of involvement that we needed. But had I not been already working in the field and been knowledgeable of some of those things, I would have never known about where to get durable medical equipment, or like what I talk about today about like accessible parking and what that would mean for a family like ours. So it's trying to help get the information into family members' hands so they can have the viable resources needed. They can do things on a day-to-day regimen that's best for their family and participate in life just like their neurotypical counterparts. So that's kind of the way we try to help do things. Try to help. Sometimes we'll get calls from like a clinic's case manager, and they may ask us for wheelchairs or ramps or something like that for a family. Well, that's not what we do, but we help say, hey, these are providers for that. Here's a support group that those family members can attend. So we try to just pass that information on to families as they need it.
Well, before I forget it, how can somebody connect with your organization?
Sure. We have a Facebook page. We're on Facebook, so it's the Arkansas Disability Coalition. We also have a page that's specifically for the Family to Family Health Information Center of Arkansas. So if you type all those words in, they'll populate on Facebook. But we have a website, and it's ardisabilitycoalition.org. ardisabilitycoalition.org. So that's the best way to find us. There's links on there and phone numbers, and we try to pass along information from other groups and keep that on our website and on Facebook. We have other social media too, but the links are coming.
All right. Tell you what we'll do. If you'll, your husband's driving, by the way, just so everybody knows, her husband's driving, but you get a chance, send all that to me. I'll get Elizabeth to put that up on the KimHammerShow.com website so people can access that information and be able to share it. Let's talk for a second, if you will, because one of the conversations we had in prep for today was about parking spots out there. And I get a lot of comments from individuals, and I have personal family friends who have family members that are dependent upon those parking spots, that when they go somewhere, it helps them be able to navigate through the parking lot and, to the stores that they want to go to. So it is kind of personal to my perspective as well. But let me ask you, first of all, how is it that you determine the number of parking spots with regards to a store and how many they're supposed to have? Do you have any of the knowledge about the mechanisms that go into the decision of how many spots should be in front of a store?
Right. Well, there is actually a format. There's guidelines that were created on a national level by people much smarter than I am, and so it's statistical data. So if you have so many parking spots, then you have to have so many accessible spots as well. And so when it comes to like large public venues and hospitals, then the proportion is actually a greater number for accessible parking than it would be for regular spots.
So that is all actually regulated by federal laws and by state laws as to the number, so that when a store goes in or somebody comes in and wants to complain or, comment about how many parking spots there are in front of a store, or an architect is developing plans for a new building, for example, I guess it is based on the population of the store or the size of the parking lot as to how many they actually determine are needed for that location.
Correct. And it's up to states and local, local officials to enforce different parking aspects. Like if I have van accessible disability tags on my car. And so when we travel to Florida or St. Louis or, wherever we're going, what other state, they will acknowledge our tags, just like if somebody comes here and they have accessible tags or placard, we acknowledge that here in the state of Arkansas. But it's up to us as a state to say, are you following the law? If you're not following the law, we're gonna be in contact with you. And so, there's two things, and I appreciate you for this. There are two acts that we have in Arkansas. We updated, I believe it was 799 that was back in 2007, which included the tag for van accessible parking, and then we increased the fines and the penalties somewhat for parking. And then Act 1003, I believe that's the one that I'm thanking you for, is where we can actually report that. So there's a phone number and there's a website link where you can go in there and put the information about the person in question. So, our law enforcement, we really appreciate them, but especially in a larger city, I think that, citizens who can help report these things should do so. And so this tool helps them do that. So, people should not feel afraid to report, the person in question. One thing that people should not do, I had this happen, I think it was about 3 years ago. We'd gone to our county library, and I had the placard hanging up in my husband's truck and my daughter's wheelchair in the back. And this lady comes running out of the library, shame on you, shame on you. And she accosted me, and I said, pardon me, ma'am. And then I introduced myself, and I told her I actually served on the Accessible Parking Task Force and that I appreciated her desire to want to help families like mine. But I introduced her to Emma, and I told her a little bit about, that there are other things in place that would help police the situation that would keep her safe, because you never know how someone else is going to react. But, so I told her about how she could, call the 800 number. She could use the website link and report information like that, just to keep herself safe. And that's what, I think that's what folks in Arkansas need to understand, is it's a wonderful tool to help our law enforcement, but it's also a great way to keep yourself safe in a situation while you're helping your community, because, you're allowing them, you're allowing others to have the same kind of access to be able to go in stores and hospitals and, public places just like everyone else. And this time of year is probably the hottest time of year that people abuse parking spots.
And I think that creates some of the rub between legitimacy and illegitimate use of the blue tags that, get hung from the get hung from the rearview mirror. Let me back up and stop first of all and just tell folks we're going to get it up either over the weekend or by Monday to the KimHammerShow.com website. That link and that phone number that Natalie's referring to, it was a law that was passed, and what it would allow you to do is if you see somebody abusing a parking spot, like for example, I've got a picture of somebody that I'm sent in. I mean, it was blatant. They pulled up in front of the Dollar General store, obvious, handicapped parking spot, got out and with no remorse at all, went into the store, did their stuff and came out. And I don't know how you feel about that, but that just gets under my skin. So what you're able to do is take a picture of the car with the license plate, and also you need to have it showing the handicap parking zone and have a clear view that there's not a tag hanging from the rear view mirror. And I did this really quick. It's all about positioning and angling. And I actually did it after the person went in the store because I wanted to avoid a confrontational situation. And you can send that picture in, and they will get a nice little letter saying, we know what you did, and it'll go on file. One of the things I'd like to promote is actually that we would have a day where citizens could do that, and that would, I think, help send a message, but we're going to coordinate to make that happen. But in the meantime, that is something that you as a citizen can do. If you see somebody violating that, be an active participant to help send a warning to people. You don't need to violate those. Let me ask you, though, Natalie, because this is one thing that I hear some criticism about, is people that abuse that blue tag. Talk about, if you will, the requirements for getting the blue tag, who's able to use the tag, how long the tag can be kept, and your thoughts about people that abuse it.
Sure. Well, to receive that tag, you can have plates, or you can have plates and a single placard, and the placard has an expiration date on it. Or you can have just the placards. If you use only the placards, every time they issue, the DMV issues those things. You have paperwork. You have paperwork that is signed off from your doctor's office that you bring in to pick up those tags. And then you have the paperwork that is printed, and then you sign from the DMV. They need to be kept with wherever that blue tag goes. And that's kind of the kicker to all this is, some people think, it's the day after Christmas and we want to hit all those sales the day after Christmas when, and we're just going to take Nana's placard so we can park closer. Well, it's not really about parking closer. That's not what accessible, parking tools are for. It's so that person can get out of their vehicle and into the place that they want to go or need to go. So if it's a van accessible spot and you have tags, but it's not a van accessible tag, if at all possible, don't park in that place. If you have, because it's about being able to open the door and get the person out of the car and where they need to go. So, and the doctor's offices, they have, they have the list as well of what is allowed to apply for tags. So it's in the realm of physical disabilities. That's, and they have a checklist. So they can ask their doctor's office about it, but it doesn't necessarily mean because you asked for it that you were going to get it. But like with our family, at one time I was a sandwich caregiver. So that means my 90-something-year-old grandfather lived with us, as well as my daughter that had the medical complexities I spoke of earlier. And so they each had their own set of equipment, but they had the placards for different reasons. So I kept all that information in my trunk. But when my grandfather had friends that would take him places when we couldn't take him, or he could no longer drive himself, then we would take his placard and the paperwork and wrap it up and give it to his person. So even though I had two different people with two different reasons, it's not like we necessarily shared that piece so we could get around. And so that's what I would encourage people to really think twice before they take advantage of a loved one's accessible parking tool.
In reality, the placard goes with the individual. So no matter what car they're in, for example, if somebody should stop or question someone, or the officer should stop and question someone, if they can present the placard with the identification saying that this tag belongs to Johnny Smith, everything's fine as far as that,
right.
that blue placard is concerned.
Right, because when you have a person that has that little blue placard, you can take a picture of the license plate number, but you also need to get the picture of the placard, because the number, there's a number printed on the front of that placard that's supposed to be facing out when the car is parked. You know, a lot of times you'll see people and they still have it hanging up while they're driving around or whatever, and you're actually not supposed to do that, but that's a whole nother story. But the number is supposed to be faced out. So if an officer wanted to get more information, did it really belong to that person or not? You could take a picture and see that, because some people are issued placards and they may not appear to have a physical disability to you, but they may have that and need it, and that's a little bit that could be a little bit of a safety issue. And so that's why when we report this information, someone follows up with it and they can go, oh yeah, so and so is with them, so it's okay, because they had the correct information. But if not, then they'll ask all the questions. I mean, that's part of the process of calling it in.
Okay.
And then, taking those pictures and all that.
All right. We got about 3 minutes left, so let me just bring one idea up. And I know down in Florida, they actually enacted a citizens group that were trained and authorized to approach people about actually, I think they can issue citations, but in reality, I think it's more a matter of representing in an official capacity somebody that approaches or that, violates a parking spot, and they are there more for educational purposes or just to serve notice. You got any ideas about that and how you think that might react or be responded to in Arkansas, or do you think that there's more that we need to be doing, or are we doing enough?
Well, I feel like if we can get people to use the app, if they will use that phone number and use that web link, that would be really helpful to so many families in our state. Florida has really stiff penalties for parking space abuse. So if you park in a spot, they're going to give you a $500 fine for the first injunction, and then they can order up to 6 months in jail. And so the citizens group, like you said, they're an education group, but they've also, after they've gone through their training, they can actually issue the citation themselves. It's a legal piece of paper that that Florida takes very seriously. And I think part of the reason they do that is they have a lot of retirees there, but they also have a lot of people that come from other places. So, they do take it seriously. I think we should take it more seriously in our state. I feel really good about what we've done over the last few years. I just think that we need more partners in helping make sure that we park where we're supposed to, and that if we see somebody, do what's courteous and remember that other person's freedom, and that will be the best thing that we can do here.
All right, we're down to less to a minute on the Kim Hammer Show. You've been listening to Natilie Wooldridge with the Arkansas Disability Coalition Family Advocacy Coordinator. Natalie, you have that 800 number handy by any chance?
Let's see.
And while you're doing that, let me just say we'll get it up on the website if we run out of time, and you can go up there. We'll get it up there by Monday so you can have that number and be able to utilize that service.
Okay.
All right, very good. You've been listening to the Kim Hammer Show. We hope you have a great rest of the day. Remember, next Saturday I'll be out. I've got to conduct a funeral. Senator Jason Rapert will be filling in for me. I know it'll be a great show. Thank you for listening to the Kim Hammer Show here on 101.1 FM, The Answer.
.1 FM, The Answer. KDXE FM, Kamak Village, Little Rock. A Salem Media Group station. 101.1 FM, The Answer.